moving on to the next expert, Dr. Cecily Mazela. She is a very famous interventional cardiologist from Tamil Nadu Multi-Speciality Hospital, which is a government hospital. And welcome you, ma'am, to WCC 2023. First of all, share your experience. How are you feeling at today's event?
Yeah, it is a great event. I would like to thank Dr. Jyotsna Madhuri ma'am, the founder of Vincas, and Dr. Sarita Rao ma'am, who has been the organizing secretary of WCC 23. She has organized it in a very grand way. She has brought in all the stalwarts all over the world, both women and men who are much experienced to share their views. It's a great experience. So whatever we have learned in cardiology over so many years, we have grabbed it over these 2 days. Definitely, it's a great experience.
Okay. Can you talk about your presentation?
Okay. My presentation today was tips and tricks of RSOV device closure. So this ruptured sinus of Valsalva aneurysms are usually quite rare, but relatively more common among Asians when compared to the entire world. So these patients present with cardiac failure. So even if we do not treat them, they succumb within 1 year. Either we have to close it with the device percutaneously or send them for surgical closure. So the idea is we have to treat them early and treat them quick. But what method has to be selected is we have to rule out all the exclusion criteria, which is the patients who have associated ventricular septal defects, who have multiple exit sites, very large defects more than 15 millimeter, those associated with the aortic regurgitation more than grade 2, or these patients or associated infective endocarditis, they should be referred for surgery, whereas the other cases should be properly selected, and percutaneous closure can be done very efficiently in these patients. We have done up to from 12 years to 72 years, which age is not a criteria. We can close them so that they recover completely from stage 4 failure. They recover, they get back to class 1, and they are able to do their routine activities.
Wow, that's really commendable. Ma'am, as you're working in a government center and you must be doing so many registries also. I think recently you had some paper also on that registry. Can you share some data about that?
Yeah. In Tamil Nadu government, the government sector, we have multiple registries. One is for pregnancy and heart disease. We have the STEMI registry. It is being run all over Tamil Nadu, and Professor Dr. Justin Paul sir is the head of the registry. He's the main research person in that, and all the teams are included in it, and we take active participation. All are being enrolled so that we identify in pregnant women. It has been now recently published that patients are identified earlier. It is a cardio-obstetric team which completely supervises these pregnant women who have cardiac issues, so that they are being monitored completely throughout their pregnancy and postpartum, so that the outcomes are much better. See, when there is a multidisciplinary approach for such patients, and all over Tamil Nadu, any patient from anywhere, if there is a doubt regarding that patient, a complex congenital heart disease or a valvular heart disease, it is being immediately put in the whole Tamil Nadu group, the cardiologist and the obstetrics forum, so that the answers, all the experts' opinion are immediately got within 1 minute or within 5 to 10 minutes, so that patient who is from a remote village or from a remote corner is getting the expertise treatment which is available at par in the topmost cities or the quaternary referral hospitals. So that is the excellent teamwork which is being organized. The STEMI registry also, any patient from anywhere, even in a remote site, they get the ultimate treatment. They are referred to the closest hub hospital from the spoke, where all interventions are available. The team is being activated, it is being triggered, so that all patients, so that the mortality comes down, and the patients are really benefited. And that is the Tamil Nadu government has been really a forerunner in STEMI registry and pregnancy and heart disease registry.
Okay, that's very nice, because we need such kind of the government support if we want to really work at the population level. One more thing, ma'am, do you have a dedicated cardio-obstetric unit at your hospital?
Yeah, see, the thing is, all OG hospitals are attached to quaternary hospitals where the cardiology team is functioning. So, all hospitals, for example, IOG, Institute of Obstetrics and Gynecology, IOG is attached to Madras Medical College Hospital. KGH is attached to Tamil Nadu Government Multi-Super Specialty. It's a team collaboration. Everywhere it is being aligned like that.
Okay. That's really wonderful, and it's really heartening to have a communication and have a word with you, ma'am.
Sure.
So, anything else you want to share, ma'am?
Oh, thank you so much for the opportunity. As rightly said, my word to the young cardiologists, budding cardiologists, both women and men is, nowadays everybody is interested in interventions. But what I would like to say is, always from the basics we need to go. Don't jump into intervention. You have to see the patient as a whole. We have to examine the patient thoroughly, auscultate them. See, that will give you a lot of idea. Listen to them. Listen to them both empathetically, and you have to listen. See, in this era of medical legal issues, why we are getting into medical legal issues is you're not listening, giving a ear to the patient. We have to listen to them properly. Get the diagnosis from them. Whatever they tell, we'll have to listen to them. And then auscultate them. Do the methodical procedure. And then do the intervention. And then follow them up. We have seen many youngsters just doing the intervention, leaving the patients without even seeing the patient in the post-procedure unit. That is very, very mandatory, because a true
that is
procedural...
very important point that you have highlighted. That
yes, ma'am.
Being a good interventionist is a separate thing, but before that we have to be a very good clinician, and for that we need some traits, that being a good listener, being empathic to the patient also, and to see the patient, to listen to the patient, to have proper examination, to have a concrete diagnosis before going for the intervention.
Yes, exactly.
Thank you so much, ma'am.
Thank you so much for the opportunity. It was great.